Hey everyone, thanks for taking some time out of your Tuesday to join us. My name is Regan Innes.
And I'm Tiffany Sutherland.
And today we are going to be talking about carpal tunnel. So all of that entails with carpal tunnel, what it is, what we can do to treat that, and we have our Trivia Tuesday question today that also involves carpal tunnel. So I'll let Tiffany take that away while I share this to our preferred page.
So, for Trivia Tuesday this week, the question is, who is more likely to be affected by carpal tunnel syndrome? Is it men or is it women? And just shoot your comments in on the post, and we'll be able to choose a winner from that.
Awesome. Good deal. Let's see. And we're good to go.
Did we need to choose a winner from last week?
I will personally message the person of the winner so we can get them their Amazon gift card. So $10 Amazon gift card for our winner. So be sure to place your answer in the comments below. And if you want to give that one more time.
Trivia Tuesday question for this week is, who is more likely to be affected by carpal tunnel syndrome? Is it men or is it women? And again, just put that in the comments on this post and we'll be able to choose a winner.
Awesome. Okay, well, we just wanted to say thanks for joining us again. Today we are talking about carpal tunnel. Looks like we've got a few viewers, and thanks for taking some time out of your Tuesday. So first off, Tiff, what is carpal tunnel?
So carpal tunnel syndrome is actually, it occurs when there is compression on your median nerve, which runs along your forearm, down through your wrist into the palm of your hand. So what's going to happen is you actually do have a little tunnel in your wrist called the carpal tunnel, and it is caused by just compression in that tunnel on the nerve, most often than not.
Right. So if I'm experiencing carpal tunnel, what sort of things would I be feeling?
So a lot of times it's going to be kind of a gradual start to it. You're going to feel some like burning, tingling, itching, kind of numbness in the palm of your hand. Usually that's starts at night, and it'll sometimes wake you up. Sometimes you'll just, when you wake up in the morning, you might have some numbness in your hand. It's going to affect your thumb, your index finger, and your middle finger, and sometimes can start to affect your ring finger a little bit, but mainly it's just your thumb, index, and middle finger. And a lot of times at first it starts to get caused because a lot of people like to sleep kind of in that like cramped up position. Their wrist is flexed, and so a lot of times that's why you start to get symptoms more at night, just because of how you're sleeping. And then it can start to gradually start affecting you into your day too. Usually that's going to be a little bit more severe, and people will still start having that problem of numbness, tingling, that kind of stuff. And then you're also going to, you can start experiencing like a decreased grip, like, you go to hold onto your coffee cup and notice that you drop it. It also can start affecting, you being able to make a fist, grab and hold on to things, some of your other manual tasks.
Right.
So,
and is it both hands, one hand?
It can be both. It kind of just depends on the person. Sometimes carpal tunnel syndrome can be caused by genetic factors. So you can just be born with smaller carpal tunnels. So you're going to have more problems with compressed nerves, and you don't really have
not a lot you can do about that.
No, you can't. So otherwise, sometimes it can be a combination of factors. You can have trauma like a break or fracture or something that causes swelling in the area. Actually, there are some causes of it with pregnancy and postmenopause, just with that retention of fluid, and then another very common cause of it is because of work stress. If you're maintaining the same position in your hands, or you're having to do really repetitive tasks at work.
Yeah, definitely. Well, with the aircraft industry here and people working on the lines, that would be something I would feel like would be fairly common.
Yeah, we see quite a bit of it in factory workers, and then a very large caseload just from your everyday like office personnel, people that are on the computer a lot, that kind of stuff.
Definitely.
So,
I would imagine there would be an increase with people on their phones now,
yes,
too.
Actually, that is a big one. Texting has really caused some problems, especially with how big phones have gotten as well.
Yeah,
trying to hold on to that and, people looking at it for such an extended period of time.
Yes,
Yep.
definitely. Yep. Well, we do want to say hello to some of our viewers. Looks like we've got Whitney, Courtney, and Janet on watching us. So thanks for taking some time out of your Tuesday. We are talking about carpal tunnel syndrome and what that can do for you and what we can do for you to help treat that.
Yes.
So
Yeah.
we've talked a little bit about some symptoms. That's burning, tingling, because you said it is the nerve
Yes. Yeah.
that causes that compression
Yes,
of the nerve.
the compression of the nerve. Yeah,
Right.
yeah. Usually, it's not necessarily a problem with your nerve. It's just the compression that's being placed on it in your wrist.
Right. So, what are some treatments that we can do for carpal tunnel syndrome?
Some of the treatments, so actually there are several non-surgical options, and usually that's more identifying it, in the earlier stages, trying to change some of your habits. One big thing is you can use some splints at night, which keeps your hand in more of a neutral position. You're not able to sleep with it so crunched up. Another one is stretching, taking those breaks during work, really letting your hands take a rest and kind of stretch out and stuff. Physical therapy is actually another great alternative to surgery, especially if it's not that severe or, if it's not really a genetic thing.
Sure.
Because, you can get in, you can get some exercises. A-stem, which we actually talked about a couple weeks ago, correct?
Yes.
It's a great treatment for carpal tunnel. It's helping to, decrease some of that swelling, get some of your blood flow back in the area.
Definitely.
So, yeah.
So, would you show us some stretches? Maybe something we can do at our desk to help with that numbness, tingling?
Yeah, of course. So they're actually really easy ones. They're ones that you can just do in a seated position. You don't need to get all crazy with them.
Don't need sweatband
no sweatbands needed.
Okay.
So what you're going to do is the first one is you're just going to extend your arm. If you start to have any pain or numbness or anything from having your elbow fully extended, just put a little bend in it. It just kind of depends on, if you are having any symptoms or, depending on the joint mobility in your wrist. But you're just going to hold that back and count to, we usually like to say 20 or 30. And then another one you can do is bring that wrist down. Yep, very good. And sometimes it helps to have your thumb of your other hand kind of in the palm or bracing against your the thumb of the wrist that you're trying to stretch, just to give it a little bit more stabilization. And you're just going to hold that one down for that 20 or 30 seconds. Again, you can keep a bend in that elbow if it's a little bit too much stretch for you. Kind of relieves some of that pressure. And then the third position is you can bring your palm face up and bring it back as well. Some people like to use a table instead of having
or your desk.
Yeah, exactly. Yeah. Use that desk, especially if if you're having symptoms in both hands or you need to take a break. You can use a desk, table, anything, just kind of whatever works for you.
Right.
So. And then another one is, it can be a little bit more complicated, they're called tendon glides, and it's actually to get a little bit of motion through your fingers as well. And what you can do is you're going to start with just a fully extended hand. You're going to curl your fingers down a little bit, go out into, I call it the duck bill. You're going to roll it back in and then kind of down into a fist. And that's going to be more like one fluid, quicker motion. So you're just down, out, in, fist, open. It takes a minute to get the hang of it. You can find, if it's called tendon glides, you can find exercises online for it or contact any of our physical therapy locations and we'll be able to get you some exercises. We have some pretty cool exercise sheets. But yeah, again, so you're just going to extend down into a curl, out into that duck bill, back in, and fist. And then if you're going at real speed, so I like to do it with both hands, you're just out.
Just
and
like a little,
just
you're not really
no, and it's
or
not, yes, and that's the big key thing, is it's not a very severe dramatic motion. You're not really sticking it,
Right.
Because that can actually cause a little bit more stress and fatigue to those joints. You're just wanting to be one big fluid, nice, happy motion. So
yes.
Yeah.
I love it. Janet says, use that desk. Right?
Yeah.
It's got to be for more good than just typing.
Just working.
Yeah,
right.
Just
exactly.
working. Yeah.
Exactly.
I do want to say thank you guys for taking some time out of your Tuesday. It looks like we have a few more viewers. Ryan, thanks for coming on and joining us. We are talking about carpal tunnel syndrome.
Yeah.
We just went through a couple of stretches,
Yes.
different exercises that you can do.
Yep.
I'm going to go ahead and do my stretches while I ask you a few more questions.
Yeah, of course.
At what point should someone seek medical attention for that numbing feeling or tingling or anything like that?
The best thing is to always catch it early. You want to, honestly, of course, trying to prevent it from even getting there. So if you do notice that you're having some numbness or tingling, especially at night or whatever, you might try sleeping in some splints. You can find those at really any, Walmart, Walgreens, any kind of just a little bit of, a reminder for you not to come really, far down into that nice, comfortable sleeping position. You can also see your primary care physician. There's different kinds of ways they can diagnose carpal tunnel syndrome. A lot of them they can just diagnose just straight from symptom report. There's also different kinds of testing they can do, and of course diagnostic imaging as well. So it kind of depends on what their feeling is and how severe it is. But one of the best things is to start PT right away. Kind of get on that, start some exercises, being sure to incorporating those breaks. Even if you aren't having symptoms throughout your day yet, the most important thing for everybody, no matter what, body part it is trying to get those stretches. And if you're, maintaining the same position for a lot of your day or doing, a lot of the same motions, try and do a stretch warm up before your day starts. Take a couple of, quick breaks throughout your day, especially if you've been really hammering away at one task for a long time. And another, if it is severe, more of a genetic thing, you just have really small carpal tunnels, then surgery is an option and is usually very successful. A lot of times they will have you follow up with therapy afterwards, just because sometimes, there's some scar maintenance that needs to be done, some strengthening again, that kind of stuff.
Definitely.
So
people have lots of options.
Oh,
it's
yeah.
not something that they have to live with, and that's the main thing we're trying to get across is, PT can be very helpful on the front end, and if you do end up needing surgery for your carpal tunnel syndrome, we can come back afterwards and give you some exercises and recoup and get you back on track to your everyday life. So, if you have any questions, maybe you're watching the replay, maybe you're watching us live, be sure to drop them in the comments below. Looks like Janet has one question. It says, do I need a referral from my doctor in order to come and see you?
Yes and no. There are some insurances that let you see a physical therapist. It's called direct access. That is a great question. If you have any questions on, whether your insurance allows that, or if you do have to go in and see your primary care physician, the best thing is just shoot one of our clinics a call. We can figure that out for you and let you know what you need to do to be able to be seen.
Definitely.
Yeah.
Awesome. Well, thanks again for joining us. Be sure to go back to the beginning of the video if you missed our Trivia Tuesday question. We will be sending some gift cards to our winners and announcing those on our Facebook page too. So, Tiff, thanks for joining us. We appreciate it.
Yeah.
And we will see you next week on Tuesday at 4 o'clock.
Bye, guys.
Bye.